Hello everyone, and thanks for joining us. For those of you who haven't yet set up your audio, please do that now. My name is Carla Wohl, and I will be your moderator for the second session in our new lunchtime lecture series. We had a really good turnout for our first lecture last month and are thrilled so many of you are interested in reconnecting to discuss critical issues in public health. We very much want this to be a dialogue, so there will be a 30-minute lecture followed by 30 minutes of questions and discussion. The program we're using is called Illuminate Live. In the middle of the left-hand portion of your screen, you will see a text box where you can type questions. Now, you can either type them as they occur to you during the lecture or wait until the question and answer part of the program. If you have a headset with a microphone, simply raise your hand by clicking this icon, and we will call on you to ask the question orally. You can also click the emoticons, the confused face here or the smiley face, hopefully, to give us some feedback during the lecture. Our lecturer today is Dr. Toni Yancey. Toni is a professor in the Department of Health Services. She is co-director of the UCLA Kaiser Permanente Center for Health Equity, and she serves on the board of directors of the Partnership for a Healthier America. That's the group that supports First Lady Michelle Obama's Let's Move campaign. Toni has a new book out in which she argues that we need a new approach to solve the obesity epidemic. And part of the problem, she will tell you, is that we are all right now sitting in front of our computers. She's here to give us a push to get moving. Toni? Toni, you can start talking now.
Good afternoon. I'm really happy to have this opportunity to talk with everyone about something that I'm very passionate about, which is how we get all of America moving again, how we really can deliver some physical activity minutes, not getting everybody up to the 30 minutes a day that we'd like, at least getting everyone moving by 5 or 10 more minutes a day. So moving to the first of our content slides, and a colleague, Rick Troiano, who was on the Physical Activity Guidelines Committee with me a couple of years ago, did some research actually looking at the National Health and Nutrition Examination Survey data, where rather than just asking people how much physical activity they're getting, they actually measured it with an accelerometer, basically a glorified pedometer that can also check the intensity of the physical activity. And he found that the average U.S. adult is getting about 6 to 10 minutes per day of moderate to vigorous physical activity. That less than 5% of adults are getting 30 minutes a day of moderate intensity activity, at least moderate intensity activity on 5 or more days a week, and less than 10% of teens and less than 50% of even elementary school kids are meeting the 60-minute requirement for young people. Now, we have some data from right here in Los Angeles County, the LA County Health Survey, and even though this was 1999, the numbers have not changed much. If anything, they're going the opposite direction. So in the county as a whole, over 40% don't even get 10 minutes per week of continuous physical activity. Now that breaks down such that in the southern parts of Los Angeles, of course, we have even higher rates of sedentariness. But even here on the west side where UCLA is located and many of us live, it's still almost a third of the population that doesn't even get 10 minutes a day. So that's the bad news, but it's also the good news in terms of the opportunity available to move the needle on physical activity and also on other health issues like obesity. Now, you might wonder how we got into this situation. First of all, our bodies evolutionarily were really not set up for us to go out of our way to move because we had to do so much movement just for activities of daily living, like in order to eat and sleep and get enough water and escape predators. So the need to move for transportation, work, recreation, and so forth has been engineered out of our society. And as an example, kids don't walk to school anymore. So almost half in 1969, and I certainly walked to school when I was in elementary school, but fewer than 16% in 2001. There have been a lot of cutbacks in public school physical education, which has been a universal mechanism for building the kind of self-confidence, movement proficiency, and habituating kids to being regularly active. There's also pervasive marketing of sedentary goods and services and that marketing is what creates a secondary demand. So in the case of nutrition, there's a strong primary demand in that we call hunger that drives us to eat regardless, but there's not so much for physical activity. So we really, because of that evolutionary selection advantage that in adulthood causes us to want to be sedentary, to be inclined toward being sedentary, we've got an uphill climb. And then there are also a lot of cultural barriers to engaging in physical activity, especially among women. So I like these little cartoons, and I actually intersperse a number of them in my book. Because so often we have exercise equipment, we know that we need to do better, but often we don't do so well. And this is just to make the point that we were burning 5,000 or 6,000 calories a day for most of our existence as humans on the planet. By 1915, we were down to about half that amount at 3,000 a day. 1,800 a day in the year 2000, and if we had the data for 2010, I'm pretty sure we'd be even lower because we hit a button to send a text message or an email to the person in the next office rather than walking next door. We move around a lot less. We even shop by email, a lot of us, so not a lot of opportunities, or at least the necessity to move. And then this is how a lot of people are left feeling after PE class. So PE tends to be focused on the gifted athletes, especially boys, and it's changed somewhat in recent years, but still a lot of people feel like it's 3 more, 2 more, 1 million more leg lifts. Now, I included this slide. This is from a study that we did looking at outdoor advertising and its effect, or at least its correlation with overweight. And so we looked at both the nutrition and the physical activity side, and the nutrition side, most of you know that there are lots of ads for fast foods and sugary beverages concentrated in low-income communities. But what often is not as widely known is that there are also lots of ads for sedentary behavior, so video games, television, and movies in these same lower-income communities and communities of color. Now, PE class, as I mentioned, not only are there cutbacks, but in low-resource schools, kids spend less time being active. So this is data from a study we did in the state of California looking at, we stratified by region, so northern, central, and southern California, and looking at the amount of time spent in moderate to vigorous physical activity during the actual PE class. So on your left are the lower income schools, up to 74% of the students eligible for free and reduced price lunches, and to your right are the more affluent schools, and obviously kids are getting a lot. Oh, I'm sorry, I just reversed that. The left is the more affluent schools, and the right, 3/4 or more of the students are qualifying for free and reduced price lunches, and obviously the kids in the more affluent schools are getting quite a bit more activity. But the other, even in terms of the low-income schools, when we then stratified by fitness gram levels, that's the fitness testing that is mandated in the schools. In some of the lower fitness gram schools, kids were getting on average about 3 to 5 minutes out of a 30-minute session. And this is a poem I wrote a number of years ago, but I include it just to emphasize this issue of hair and makeup and appearance disturbance. For many women, and especially for teenage girls, a main complaint, a main obstacle to participating in physical activity is not wanting to mess up the hair. And for many of us in ethnic groups where it's not as easy as just a quick blow dry, it's a major problem. So now I included this slide because this is a big issue, and it's not one that we talk about a lot, but there's often a pitting of nutrition against physical activity. So this is definitely funny. I mean, instead of passing the fat tax on soda, the government requires that people do 10 chin-ups before the cooler will open. I mean, it's funny, but at the same time, it presupposes that doing chin-ups is something that people would want to avoid. So it frames physical activity as something negative, and that's very much a part of a lot of the dialogue. I hear people saying, well, you know, you'd have to run 5 miles to work off that burger. Now, first of all, that may or may not be the case, but again, we need to be cooperating rather than competing. So this slide of the lettuce boycotts, the Chavez-era lettuce boycotts, and this one of the civil rights movement are to make the point that it's not genetically presupposed that African Americans, Latinos, Pacific Islanders, and others in the groups with higher rates of obesity and diabetes and other chronic disease, it's really not something that's genetically programmed. Now, it's not to say there couldn't be a gene-environment interaction, but what has changed over this 50-year period or so is the environment. That's what's really changed, and that's a part of these disparities. So the fact that there are food deserts, the fact that there are activity deserts. That's the bad news. So the good news is, the question is, where do we go from here? And of course, as a preventive medicine specialist, I believe that we need to prevent obesity, and that we have some great models for it in the successes in public health of the latter part of the 20th century. So tobacco control, everybody certainly knows about and claims. Drinking and driving, seat belts and child safety seats, and breastfeeding are all examples of major shifts in most of our lifetimes. And the point I want to make is that for tobacco control, for instance, many people think of it as having started with the passage of Prop 99 in 1988, but in fact, there was probably at least a decade before that of smoking bans imposed by decision makers. So whether it was work sites, parks, government buildings, but there were a lot of people that were starting to become conscious about that and make decisions on an organizational level. And that actually helped to turn the tide of political will that even allowed Prop 99 to pass, and then certainly the smoke-free workplace ordinance. Now, a number of you are familiar with these kinds of social ecological models of behavior change, and I'm going to focus on the fifth level, changing organizational practice, as kind of a sweet spot in kind of the prioritization. I mean, many models talk about multiple levels of change, and I think it kind of makes intuitive sense that we're going to have to do things on multiple levels. But one of the problems with policy and legislative change when you don't have a tremendous amount of political will is that things can be on the books and not implemented, and physical education is a great example of that. Many states, if not most, have some requirements. Only one state has a daily requirement, K through 12, but the 200 minutes every 10 days for elementary school students here in California and the 400 minutes for high school students are, by and large, not adhered to. So we really need to do something that sort of bridges the individual knowledge and skill development and the actual legislative changes that we all ultimately want. I mean, we want mass media to be favored over individual cars, and most of us want to have multiple destinations and neighborhoods to walk versus climbing into our cars. So this is a model that I developed and actually published just last year in the journal Preventive Medicine to try to address this issue of how we create this kind of change. I mean, really, it's a shot in the dark, of course, but I looked at some of these other successes and basically tried to come up with a way of rolling the ball on this. So it's biopsychosocial in the sense that I'm incorporating the biological and the psychosocial at the higher levels, the more individual levels, and then looking at the connection between the organizational and cultural or sociocultural levels on another level. Now, let me just define metavolition. It's a neologism, certainly a word that I made up, that's defined as the impetus to change individual behavior that arises not from the conscious intention of an individual, but rather from leaders or decision makers who are concerned about organizational performance or the public good. And I know this is a lot of things happening all at once, but the point that I'm trying to make here, just trying to pause a moment so that I can get the right, so I can use the pointer here. Okay. So again, with organizations being the sweet spot, we as public health leaders can convince organizational leaders, the early adopters anyway, that it's in their organizational best interest to actually make a change. So incorporating brief bouts of physical activity, for instance, and that's the change that I want to focus on, although I will talk a little bit more about other push strategies or those strategies that nudge people toward more activity. But leaders can be perhaps convinced or encouraged to adopt organizational practices and policies that make the active choice the easy choice, which will then influence individual attitudes, beliefs, and behaviors, and create individual health improvements. So Mrs. Smith goes to the doctor, and the doctor says, wow, your blood pressure is down a couple of millimeters of mercury, and you seem to be down a couple of pounds. What's going on? So this starts to move in this way, so that as individuals change, they talk among themselves, more organizational units pick up on it, and if you get enough of these, then there's a spillover to the organizational level. So there are organizational benefits such as increased productivity, decreased injuries, and so forth, improve morale in this time of economic downturn. And then once you experience these organizational benefits, then you start to bring more people on board. So you've got these organizational intermediate adopter leaders who then see that there's a competitive advantage or market advantage in implementing these practices. And then this starts, I call this the accelerating level, so each of these levels I have a different term for. And then as more of this happens, then there's a spillover from the organizational benefits to the social norms. So this is where we start to develop the political will and start to bring on the late adopter leaders. And then this population social controls, this is the example from tobacco control of passing Prop 99, of passing the Smoke-Free Workplace Ordinance, where in fact you at the individual level now have some kind of disincentive to participate. So that's the brief version, and anybody who's interested can certainly go to Preventive Medicine, the October issue last year. Again, the change processes, the initiating phase from leader to leader, the catalyzing phase from organization to individual, viral marketing from individual to organization, accelerating from organization to organization, anchoring from organization to community, and institutionalizing from community back to the individual. So again, as I mentioned earlier, there are a number of opportunities for us, and because levels of physical activity are so low, for instance, 3-minute bouts of physical activity 10 times a day have been shown to lower serum triglycerides to the same extent as one continuous bout. Another study in youth from the National Health and Nutrition Examination survey data, again, where they actually use the accelerometers to objectively monitor activity levels, the number of bouts of physical activity were independently associated with physical activity volume, so that in youth, weight status or being overweight was influenced not only by how much, as in how many bouts, how much total time of physical activity multiplied by the intensity of the physical activity, but also by how many bouts of physical activity kids got. And so kids that got more bouts were less likely to be overweight. And then lastly, in the Nurses' Health Study at Harvard, sedentary behaviors such as watching TV, as well as getting less than the 150 minutes of moderate to vigorous, contributed to diabetes and obesity risk. So just getting people up and moving around decreased the number of new cases of diabetes and obesity over a 6-year period of observation. So again, the push approaches, and I mentioned brief bouts of activity, which you're about to get a little bit more of an idea about, those that have not participated before, but push approaches, again, making the active choice the easy choice. So they include integrating brief bouts of activity or 10-minute instant recess breaks at scheduled times of the day and in meetings. Having them in meetings is great as a modeling tool, but a lot of times the people lower in the hierarchy of an organization don't go to meetings as much. So it's important to also have it at a scheduled time of the day and to have leaders within the organization participate, even if it's not regularly, even if it's not daily, but monthly or something. Restricting nearby parking spaces to people with disabilities, moving the employee or student drop-off point or pickup location farther from the building entrance. So there are examples of schools that require that parents drop kids off at the back of the field and let kids run across the field or walk to get to school. Scheduling walking meetings at least weekly. Again, something that we actually have a little experience with at UCLA. The dean actually, with those department heads that are willing, has walking meetings. And here's an example from my alma mater, Duke, of a walking meeting in progress. Now, instant recess breaks have an advantage in my mind over a number of these push strategies. First of all, you don't necessarily have that ability as a leader to govern the spaces for people with disabilities, or walking meetings are not as often. And when you have a walking meeting for people that are very active versus people that are less active, it's sometimes harder, and you can only do it with very small meetings. But there really are very few settings where you can't integrate 10-minute exercise breaks into the regular routine of the organization. And short bouts are easier for sedentary individuals. They minimize sweating and hairstyle disturbance. And the variable intensity, again, with low impact activity accommodates people who are carrying a few extra pounds, who are less fit, or who have disabilities. Now, social support and desire for conformity drive participation. So if there's an expectation on the part of the organization that people participate, like it's going on as a regular meeting, there are a few people that skate out the back door, but the reality is that most people, kind of take the path of least resistance. The framing. We need to have more physical activity associated with fun, play, stress release versus work and obligation. And then lastly, framing as an entitlement. So if we have people in certain levels of an organization, like I can come in later and go to the gym, or I can step out and go for a walk, but a lot of people don't have that opportunity, especially people in administrative positions and people in direct service positions like sales employees or people on the assembly line. So if they're not allowed to get up and disrupt sedentary time, which we know now there's a burgeoning inactivity physiology area looking at not just whether people get the 30 or 60 minutes a day, but how much time is spent sitting, and that actually contributes independently, as that earlier slide I showed of overweight in youth indicates. So if people are actually having poorer moods or metabolic problems from sitting for long periods, then it really should be an entitlement to have these brief bouts of physical activity. And that's actually an argument that is working right now in Washington, D.C. with one of the city council members teaming up with the head of the local Teamsters Union to get city employees to be able to have these structured group exercise breaks. Now, this is a slide from some work we did in collaboration with UC Berkeley about 10 or so years ago, and getting the WIC clinic employees up and moving, doing exercise breaks, giving them videos and audio tapes at the time, and encouraging them, helping them to understand that there's a widespread environmental problem. This is not just about individuals, being lazy or not understanding, that they need to move. So there was increased perceived workplace support for staff physical activity, as well as a number of positive nutrition outcomes, and also increased self-reported counseling behaviors among the WIC parents. Now, this was a study in which we worked with the Mexican Ministry of Health and did a secondary data analysis. They regularly collect clinical data on all their employees, and what they did was, this is their main foyer area, they did a 10 to 15 minute mandatory exercise break to music that was broadcast through the intercom system. Those that didn't want to do it in the large group could do it individually at their desk, but their bosses had to do it with them. So it was a pretty large sample and about 75% retention at 1 year, which is quite good for worksite samples. And on average, they lost about 1 kilogram of body weight and about 1.6 centimeters, a little over a half an inch of waist circumference. And this was a demonstration project, so there was no control group, but we pretty much know what the secular trends have been, and those are to gain weight with time and to gain in abdominal obesity. So this is a pilot study that we have for our current large-scale project funded by the National Institutes of Health, in which we identified about 25 sites, almost 400 people were involved at Health and Human Services agencies and nonprofits, and the workforce was predominantly female, about 90% and predominantly African American or Latino. On average, middle-aged, obese, and abdominally obese. And this is some of the objective data from the third cohort. We're just in the process of examining all of this data, but you can see that the intervention group, their blood pressure declined by a very small amount. Control group increased a bit for a total effect size of down 2.5 millimeters of mercury. The intervention group didn't gain weight, and the control group did gain 2 or 3 pounds. So again, there was a stabilization of weight for the intervention participants and the usual secular trend of increasing weight and waist for the control participants. So we actually are just getting ready to publish in the American Journal of Preventive Medicine a systematic review of the literature on incorporating brief bouts of physical activity into workplace and school routine. There were about 40 studies, and a number of things have been demonstrated: organizational receptivity, on paid work time and during the school day. As a matter of fact, high school exercise breaks have actually been recommended as a part of the White House Childhood Obesity Task Force. Definitely contributes to the daily accumulation of activity. It's a teachable moment. So in one of our studies, we actually demonstrated that people that were sedentary who participated in an exercise break versus the usual bathroom or phone break rated their health status and their fitness status lower. And you might say, well, why do we want to lower people's perceptions? Well, it's kind of a wake-up call. So people that don't have to move regularly, and that describes most of us, may not really realize what kind of shape they're in. So usually people are kind of startled, that it's only been 5 minutes and they're already, kind of sweating just a little bit or glowing. Again, effect on a variety of systems within the body, so mood, attention span, helps with disciplining kids and academic performance. They have 3-minute jumping breaks that actually improve bone mineral density and bone architecture. Several studies, including one of ours, has demonstrated a spillover from participating in these breaks and active leisure, and then favorable return on investment. So in the case of one of the companies that I interviewed for the book, the LL Bean Plan in Maine, where they've been doing exercise breaks for about the last close to 30 years, and they stopped the assembly lines for 5 minutes 3 times a day, and for that 15-minute investment got 30 minutes of productivity. So not only did they get productivity increases, but they decreased injuries and other things, to the point that now, rather than just the stopping it stopping it for 15 minutes a day, every hour on the hour they give people a few minutes of exercise or stretch time. This is an example of one of the ways that we're disseminating instant recess. We've been working with several sports teams, including the LA Sparks and the San Diego Padres. It was the first team to adopt this strategy, and they've been doing these brief activity breaks during their pregame shows in the park area outside of the main stadium. And our goal here is to make prolonged sitting as socially unacceptable as smoking or drinking and driving, and utilizing high visibility athletes and organizations in order to bring attention to this issue. We've also worked with Forsyth County schools in North Carolina, and as a function of a very successful pilot study, they've actually now agreed to scale up, so to do this throughout their entire school district. And it's now time to give you a sample of what we're talking about in terms of instant recess. So this is actually a break that we're still in process of producing for the California Endowment.
Toni is going to just, Toni has a new book out, and Toni, you might want to talk about that for a moment, and then we're going to take some questions from those of you out there. So they're coming in quickly. So Toni? Toni, your mic is not on. You need to click Control F2 at the bottom. There you go.
Okay, got it. So I'm actually going to stop there and let's have some questions and answers. And those that want to peruse the book, you can go on Amazon.com or look at a couple of those slides. But I'd like to go ahead to our Q&A session.
Tammy, you've got your hand raised, so why don't you go ahead and ask the first question there. You need to press the Control F2 there at the bottom. Okay, well, Tammy figures that out. Why don't we take, Toni, some of the questions on the, if people have questions, they can write them in the box there on the text box, and meanwhile or raise your hand. You can just raise your hand, click the icon like that, and we'll call on you there. In the meantime, while we're waiting for some people to ask questions, Toni, you've been out there talking about instant recess for quite some time now. What is it going to take for it to be a success?
Well, actually, that's why I wrote the book. I mean, I feel that we're talking to each other within the public health community and among other healthcare professionals, but we're not really getting the conversation or the dialogue going with the broader public. So, you know, I kind of wrote the book in a more lay-friendly kind of style, use cartoons, use poems, and, you know, just tried to kind of make the subject come alive and use a lot of examples of organizations that we've been working with. I mean, this is a strategy that we've been working on for the last 10 years. And a couple of other places, they've also been doing that, like with the schools in Take 10 and the Mexican Ministry of Health project. But, you know, I think we just have to start talking about it. And one way to do that is to have a book, which is a product, and, you know, kind of do radio and TV interviews and, you know, try to get the dialogue going on a much broader level.
Rachel has written a question there. She's asking what is the intensity of the 10-minute exercise?
Right. So the intensity level is certainly going to depend on the level of fitness of the person, but for most people, it's moderate intensity. So it's about the level that you can still talk, that you're, you know, perhaps glowing a bit but not breaking a full sweat. You know, your heart rate and breathing are increased, but not, you know, to the point that, you know, you really feel that you're exerting yourself.
Folks, if you have questions, just write them in the text box there. Toni, I think a lot of people would be sort of pessimistic that 10 minutes can really make a difference to somebody who is obese. What would you say to that?
Well, I think that there's an awful lot of data, and again, that's why we just conducted this systematic review of the literature to demonstrate the range of benefits that, you know, accrue with only 10 minutes a day or 10 minutes at a time. And again, part of the reason for that is that the levels are so low in the general population that, you know, 10 minutes might double the levels of activity that many, if not most, adults are getting. Now, I see another question about the name of the book, and it's actually called Instant Recess, Building a Fit Nation, 10 minutes at a time, and I just scanned back to the cover of the book. So I'm really excited about it. It's actually not even formally out yet, but it is out in most Barnes & Noble locations that I've been to, at least in the Los Angeles area, and it's available on Amazon and barnesandnoble.com.
Carolyn is also asking a question. Would you say school-age children are your main target, or does the instant recess approach aim to target multiple populations at once?
No, actually, I'm looking to target multiple populations at once. I mean, and this has been a part of the dialogue at the Institute of Medicine Standing Committee on Childhood Obesity Prevention and other groups that I've been participating in nationally, that we certainly need a focus on places where children are, so, you know, schools, after-school programs, even preschool programs with the problems that we're having now in the you know, birth through age 5 population, but that's not enough. And so we really need to go more broadly, and that's the reason that the work site is such an important place. And also, you know, sports arenas where, you know, a lot of people not only are there in arena, but also see on television, with high visibility, people with credibility in the area of fitness. I think that this has to happen. And also, if you think about the recent data out on maternal mortality, which has mostly been attributed to obesity, that if we want to have healthy women of reproductive age, then we're going to have to go beyond just the settings where children are.
Toni, why don't you start with Kara's question and work your way down there?
Okay, so this is about a lot of organizational restrictions. So in a small public health agency, obstacles to implementing something like instant recess. You can find these data sound bites to highlight the benefit of investing a few minutes. You can find them on my website, which is www.toniyancey.com, ToniYancey.com. You can also, that again is what's in the book. There are a number of places where we've kind of identified the data, and the systematic review of the literature should be out very shortly from the American Journal of Preventive Medicine. But on my website, there are a couple of policy documents that we've used, for instance, with Ramsey County up in the Minneapolis-St. Paul area. The Heal Cities campaign, which is it's a collaboration between the California League of Cities and the California Center for Public Health Advocacy led by Harold Goldstein. Another question, is instant recess the new name for liftoff? Yes, it is indeed the new name for liftoff. Liftoff was the original break that we created in the Los Angeles County Department of Public Health, which was called that, lift those buns off the couches and chairs. But instant recess was a little bit better framing, a little more obvious as to what we meant, and so we just kind of transitioned over to calling them all instant recess breaks. Some of them are still individually called liftoffs. I see another question about how you break through the initial stigma of doing these sorts of exercises among colleagues. What I found is that you have to ask for forgiveness and not permission. So if I asked whether we could do exercise breaks, if I'd done that at the very beginning, I would have no takers. So I think sometimes it's a matter of just doing it and getting people to see that, it causes people to smile, laugh, kind of breaks up the monotony, wakes people up. There are a lot of immediate benefits at the organizational level as well as at the individual level. And if you're not in a position that you can do that in a meeting, then perhaps you can convince somebody in a position, a decision-making position, maybe somebody who's a former athlete or who's an avid exerciser or something like that, who might intrinsically see the value of it to, get something like this started. I see another question about whether I have a standard simple presentation for sharing with work sites, resident community schools, youth organizations, etc. And yes, there are some resources, again, on my website, www.toniyancey.com. This is outlined in the book in a more simplified way than I went over with this presentation, because it's really intended, again, not just for public health and health professional audiences, but for sort of the sophisticated lay audience. And I'd also say that we can work with you. We have a funded center from the CDC to disseminate this and other organizational practice and policy change strategies. So we've created a few things like fact sheets for organizations to use to convince others, but we're happy to work with you and help you adapt something for your own organizational setting.
Toni, what would you say has been the biggest barrier in getting schools and organizations to do the instant recess breaks?
I think the biggest barrier, well, I think a couple of things. One is just inertia. I think it's something new and different that a lot of people just think of as outside of the normal way of doing things. And culturally, there's a lot that sort of speaks to not doing it. So for instance, during meetings, a lot of us try not to fidget, try not to get up and move around, because that might be considered disrespectful to the lecturer. So in a lot of cases in organizational culture, it's really frowned upon to be getting up and going out. It's more something to be chained to your desk and to be viewed as really working hard. So I think we have to get beyond those cultural issues. And then I think there's another issue culturally, which is that, you know, just like Ken Cooper at the Cooper Institute for Aerobics Research created kind of the jogging movement and coined the term aerobics, and that was kind of culturally grounded for whites and affluent groups. But I think that dancing, music, movement to music is something that's culturally compatible for many communities of color, including African Americans, Latinos, Pacific Islanders, American Indians, and also women tend to like to dance more so than men. So, you know, the kind of usual way of framing exercise as sports, you know, often doesn't work for many groups, and the groups that are least active are women and people of color. I see that somebody, our department chair, Fred Zimmerman, said he's fidgeting as he listens. So don't take it personally. I love that, Fred. Thank you. And I also see another question about whether there's a strong potential for jobs in worksite wellness these days. Where did somebody with a health education background start? You know, I would hope with healthcare reform and the tremendous emphasis on prevention, the awareness that that worksite policies are an important mechanism, that worksites are important settings by which to promote healthier behaviors and to model those for, you know, spillover to other arenas. I hope that there will be more job opportunities for worksite wellness. I think in many large corporations, they have wellness coordinators, many of whom have health education backgrounds. But, you know, if I were to say where to start, I mean, I'd say wherever you're working, that you can yourself become kind of a champion for these kinds of changes. And, you know, once people sort of pick up on you doing that, you might even be able to create a bit of a niche for yourself. One of the things that we try to do in our NIH-funded project is to get organizations to write these wellness duties into somebody's job description, because, you know, many of the organizations we're working with are small, they're nonprofits, they're places that don't have the organizational capacity for full-time wellness coordinators, and yet, you know, we feel that we've been successful in convincing a number of organizations to at least include that as a part of someone's duties so that there's accountability. Because otherwise it's kind of, you know, if somebody thinks about it, if somebody's volunteering, then, you know, then they do it, but, you know, sometimes it falls through the cracks. Now, we have a lot of DVDs and CDs. Part of the reason we memorialize these exercise breaks in that way is to make it easier, to make it kind of plug and play.
If you have questions, write them in. Here comes one from Carl.
Yeah, somebody's writing in that a part of the approach is to get people to exercise without telling them that that's what you're doing. And absolutely, in our materials for Instant Recess, we talk about physical activity, we talk about movement, we talk about dance. We really don't talk about exercise per se. And the motivations that we talk about, like in the meta-volition model, the motivations have nothing to do with exercise or individual health. We're convincing leaders that it's in their organizational best interest. So let's take a faith-based organization. Well, if you want your parishioners to tithe and to, you know, be able to show up, to have long lives and be able to volunteer and, you know, maintain all of those activities, then it's in your organizational best interest to do activity breaks. And we certainly had a number of churches, particularly in North Carolina, where we've worked directly on the Instant Recess Project, doing these breaks in, you know, choir rehearsal hospitals and Sunday schools and that sort of thing. But we actually have a few churches that have actually taken it upon themselves to adapt them during the actual service time. So, and you can see some of these on YouTube. You can either access it through my website, www.toniyancey.com, or you can access it on YouTube. If you type instant recess into YouTube, you can see a number of these, like one in a church in North Carolina, and there are a lot of opportunities, I think, to integrate these kinds of breaks slowly but surely. You may not be able to get it done every day all at once, but I've certainly seen a culture change happen here in the state of California over the last 10 years within the health community. Now when we ask for a show of hands and say, you know, who's participated in an instant recess or exercise break, you know, as a part of the normal activities, we usually get a show of about 2/3 to 3/4 of the people. So, you know, I think it is becoming something that people are more accustomed to and doesn't seem as, you know, sort of outrageous or out of the box.
Toni, I'm wondering if you have a favorite story about somebody who was perhaps, you know, a little hesitant about doing one of these breaks and then became a convert that it was really doing good.
Yeah, actually, there's a great story about one of our sites that we worked with during our pilot study. It's actually one of the child care centers in a housing project here, and CBS News actually covered this, so you can actually access the story from my website. But there was a woman who about 2 years ago was quite overweight, and when we introduced this whole concept of, you know, the workers, the child care workers doing these exercise breaks with the kids, I mean, she was a little reluctant and, you know, really didn't think it was for her. But one of the great things about having children involved is that they remind you and they really want to do it. I mean, kids are programmed for activity because it's so important in, you know, cognitive, you know, brain development and, you know, skeletal development, muscular development, and a lot of other things. So they actually found that over time, they were able to, you know, do these breaks on a daily basis, sometimes more than one time a day. And this woman, when I saw her, when the news folks came in to tape this, I didn't even recognize her. She had lost over 100 pounds, and you know, this just kind of rolled the ball. It's not to say that 10 minutes a day is going to convert anyone from, you know, obese to, you know, the normal weight category, but I think what we're trying to do is just an incremental change strategy. It's like, what's a step in the right direction to get us moving, and a step that most people can implement. Let's see, I see another question indicating, okay, Diane, that you like the idea of needing to move the needle, and you've read a lot about intrinsic motivation being a more powerful motivator than external. So after you get people moving, what's the next step? Well, I think part of the answer to your question is that people have become very disengaged with movement. They've been very disengaged with their body and with the pleasure and joys of movement. So what we're doing by making it a part of the regular day is that we're kind of exposing people to it without having to go out of their way for it. And there are immediate benefits in terms of mood improvements, in terms of energy, in terms of cognitive processing, executive functioning, and that sort of thing. So with the experience of those benefits, it's reinforcing. People want to do more of the breaks, and then we determine that there is spillover into active leisure. So people are making the connection, but it's hard to get them to take that first step.
Toni, at the beginning we mentioned that you're on the board of the Partnership for a Healthy America, which is sort of guiding Mrs. Obama's Let's Move initiative. What is your involvement, and where is that going now?
Well, it's been a little bit of a slow start. We're actually a separate organization that is nonpartisan. Michelle Obama is the honorary chair, but the honorary vice chairs are former Senate Majority Bill Frist and Cory Booker, the mayor of Newark. And actually, the Let's Move campaign, which operates independently of the Partnership for a Healthier America, but the Let's Move campaign just within the last month or so hired an executive director. Excuse me. And we're just in the process of trying to finalize the recruitment for an executive director for our organization. So up until now, it's been one of the members of our board who works for the Brookings Institute, Larry Kokot. So, you know, we're really just, and it's a difficult position to fill. I mean, you know, there are a lot of political ramifications, and if you want to do something that's perceived as being at least bipartisan, if not nonpartisan, then a lot of the people in high-profile positions have connections to industry and so forth. So it's been quite a process, but there are a number of things that are moving forward. Certainly, a lot of people have heard of the chefs. Getting the chefs into the schools and working with the food service personnel. So our organization actually arranged for the purchase of the equipment that the schools needed to actually implement that. And even though physical activity is only one leg in the Let's Move campaign, I think there's a lot of movement right now to get that more off the ground. So a lot of the emphasis has been on physical activity, on nutrition, but I can tell you that the one time we met with the First Lady, I certainly talked with her about that need for physical activity, and particularly recognizing the behavioral economics to make the active choice the default choice.
I think we have time for just this one last question from Carolyn, who really wants to know about how you found being sensitive to certain techniques for group members of different fitness levels. Have you found any members not participating due to a lower fitness level?
Yeah, I think that on occasion I have seen that, but more often the people that don't participate are the people at higher fitness levels. I mean, I would say it's generally affluent men that kind of, you know, disparage this. It's kind of like, well, what can that possibly do? Because they're already active. I mean, they're going to gyms, they're participating in sports leagues. But what I've most often found is that the least fit people are the ones that come up to me afterwards, often people that are, you know, quite obese, and they say, wow, I haven't moved that much since I took physical education in school, but I can do this. You know, I can see that this is something that is within my capacity.
Toni, thank you so very much. We are out of time, and thank you to everyone to participating today. We are going to continue the conversation next month about the obesity epidemic at noon on November 17th. Dr. Fred Zimmerman, who was visiting today, will tell us that marketing is a big part of the problem. He says it's altered the culture of food and eating, and that shift is making us fat. We hope you can join us then. Again, thank you for joining us today.